my hands before the examination. Hi, Emma.
Hi.
I'm Pamela. I'm going to be doing your exam today. If you could start first by telling me how tall you are.
5'1".
Alrighty, you're 100 pounds?
Yes, ma'am.
Alrighty, so that means that your body mass index is 19. And then I have your blood pressure today at 96/66. Your heart rate is 71. Your respirations or your breathing is 12. And your oxygen is 99%. So that is great. I see here that Emma is dressed well. She has a clean appearance. She appears to be able to take good care of herself. She's grooming and appears to be in no signs of distress. If you could tell me, Emma, what is today's date?
Today is October 2nd, 2018.
Very good. And who is the president?
Trump.
Very good. And what type of place are we in right now?
We are in a room right now at a clinic.
Okay, very good. So she is oriented ×4. So the first thing that I'm going to do is to assess her skin, make sure that she has no lesions, cuts, bruises, or wounds. She does have a small bruise up here on her skin. And then I'll also take a look at her face, make sure there's none, and her scalp. Put my fingers in her hair, make sure I don't feel anything. Any tenderness or pain in the hair there?
No, ma'am.
Okay, very good. Alrighty, as we start to begin to look at her head and face, the first thing we're going to do is look and make sure that everything is symmetrical. So her eyes, her nose, her mouth, her ears, everything is the same on both sides. So when we palpated her face to look at her skin and color, we checked for tenderness. Did anything bother you? Very good. We're going to now check for her pulses and her temporal regions on both sides. Very good. And now we're going to check here for her TMJ. Any tenderness here? All right. And we're going to check the masseter muscles. Can you clench your teeth? All right. Very good. That's the same on both sides. And again, no tenderness here? Okay. Very good. The next thing I'm going to have her do is smile. Very good. So her smile is equal on both sides. Can you raise your eyebrows? Very good. Okay, you can relax. Can you blow out your cheeks? Very good. That's also the same on both sides. The next thing I'm going to do is check for dullness and sharpness on both sides to see. Can you tell me if this is sharp or dull?
Sure.
Okay.
Sure. 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 Sure.
Very good. Okay. And so that is the same and equal on both sides. She is able to assess the sensation on both sharp and dull. The next thing that we're going to do is check her vision with a Snellen chart. So Emma, if you could please just stand over there. Okay. All right. And if you could cover your right eye. All right. And are you able to see these
Yes.
letters? Okay. What's the smallest line you're able to see? What about this one?
I can see that.
You can see that one. All right. What about the smallest line? Are you able to see that one?
Yes.
Okay. Can you read from left to right for me?
O-R-Z-S-K.
Very good. You can go ahead and put your right arm down. You can cover up with your left eye. And if you can read from right to left.
K-S-Z-R-O.
Excellent. So on both of her eyes, she is 20/20. That means she can see from 20 feet away what somebody else can see from, a normal vision can see from 20 feet away. So you can have a seat. So the next thing I'm going to do is take a look at the size of her pupils as well as their reactivity. So I'm just gonna, you'll just look straight at my nose here. So on both of her pupils, they're about 3 millimeters. They are both equal and reactive. So now I'm gonna check for their ability to have direct and consensual response. So when I looked initially at them, they had direct. They both changed immediately when I shined the light in. And then if I look closely, if I shine one in, the other one, when I shine light in the right eye, the left one also constricts. And when I shine the light in the right eye, the left one also constricts. The next thing I'm gonna have you do, Emma, is look at the wall. All right, now I'd like you to take a look at the pen light. And then I'm going to come a little close. Very good. All right, so as I brought the light close to her face, her eyes did start to constrict and they did start to cross. That is a normal response for accommodation. The next thing I'm going to do is look at her conjunctiva and her irises, as well as her lacrimal ducts. Sorry, my hands might be cold. They are nice and pink. There's no sign of lesions, drainage. She has no discharge from her lacrimal ducts or any swelling. Whenever we were looking at her eyes, we're also going to check for her peripheral vision. So go ahead and take a look at me, and then I'm gonna see, we're gonna wiggle your finger. Can you see my finger wiggling here? What about here?
Yes.
Okay. You see it wiggling here?
Yes.
Okay. And here?
Yes.
All right. Very good. The next thing I have you do is follow my finger with your eyes, okay? But keep your looking forward. So I'm going to go up and down. Now as I look, I'm following to make sure her eyes can follow my finger without having any nystagmus. Very good. Okay. Very good. The next thing that I'm going to do is take a look in her eyes for the red reflex and to check for the disc and the vessels inside her eye. That is going to require me to turn the lights out. So it's going to get very dark in here. All right, sorry, I'm gonna get very close to, all right. So she does have the red reflex. When you shine the light, her pupil does turn red. And she has no vascular hemorrhages. And her disc is intact. And then that is in the left eye. In the right eye, she also has the red response. And the vascular structure is also intact, no hemorrhages, and the disc is intact. So I'm going to turn the light back on. Sorry, very bright. All right. So the next thing that we're going to look at is her ears. Are you having any pain in your ears?
No, ma'am.
If she was having pain, we would start on the ear that was not having pain. The first thing I'm going to do is look up the outside, make sure that she has no lesions, injuries, sores, or anything on that, or any asymmetry there. And I'm going to look in the auditory canal, look for any swelling, inflammation. I'm going to look at her eardrum, check for the light reflex, and to make sure that the bony structures are intact. And her eardrums look well on the right. Also do that on the left. Again, I'm also going to look at her ear, make sure that there's no lesions, injuries, or anything like that to the ear. It looks to be intact. Going to pull your ear back. Again, I'm going to look at her eardrum. Bony structures are intact, and the light reflex is present. There's no swelling or irritation inside the ear canal, and there's no earwax present either. Very good. Alrighty. Next thing I'm going to check is her ability to hear. So, does it sound the same on both sides?
Yes.
Okay. So I'm going to whisper a number in your ear, and you're going to tell me what that number is.
13. 21.
Very good. So the numbers were 13 and 20. Now I'm going to perform the Weber test. place this on her head, and she should be able to hear the sound the same on both sides. Do you hear it the same on both sides?
Yes.
Very good. So that is the Weber test. That means if she hears it the same on both sides, then she has no conductive hearing loss. The other test that we can do is the Rhine test, and that I'm going to place this on the right ear first. Let me know when you stop hearing it.
I stopped hearing.
Okay. Do you hear anything?
Yes.
Okay, very good. So if she continues to hear the sound in the after I remove it from the bone, then she's continuing to have air conduction, and then there is no conductive hearing loss on that side. And we'll do the same thing to the other side. Let me know when you stop hearing it.
Okay.
You continue to hear it?
Yes.
All right, so once again, she does not have conductive hearing loss. She continues to hear it in the air conduction after the bone conduction. That is usually a 2-to-1 ratio. Alrighty. The next thing that we will do is assess her nose and sinuses. The first thing I'm going to do is look at the nose and make sure that there's no injury to the nose, not clogged or any swelling. From what I can tell from here, her nasal passages appear to be patent or open. Are you having any tenderness along the sinuses there?
No.
Okay, so we already said no sinus pain there, no sinus pain there. She has no drainage or discharge or anything from the nose. All right. So the next thing I will do is take a look inside the nose. Can you look up just a little bit? Alrighty. As you look, I'm gonna check for redness or any discoloration. But the vessels are intact. There's no swelling. They're nice and red. Greenness might be a sign of like chronic allergies. And again, on the other side, nasal passages are intact, nice pink, no inflammation or swelling to her nasal passages there. And she had no tenderness to her frontal sinuses. The next thing I'm going to do is take a look at her gums and teeth. I'm going to put my gloves on for that. Alrighty, so I'm going to stick my fingers in your mouth to check your teeth and your gums. She has no lesions, no open areas, no wounds, no sores, anything hurting you.
No.
Alright, can you stick open your tongue? Alright, I'm going to push to the side and make sure that there's no swelling or lesions or anything down in the bottom there. Alrighty, very good. Next thing I'm going to do is take a look at the back of her throat. If you can just open your mouth and say ah.
Ah.
Very good. Her uvula is in the center. It's not deviated to one side or the other, and it does elevate when she says ah. Her tonsils are not swollen. She has no swelling or pain to those, correct? Okay, and we noted that on the exam as well. The next thing I'm also going to have her do is just stick her tongue out for me, straight forward. It is also symmetrical in the center, and it's not fasciculating. There's no movement with that. The next thing I'm going to have her do is move her neck. If you could just move it first from front to back. Alrighty, so she has no pain with the flexion or extension. You can turn it side to side. Any pain or problems with the moving that? And then you're going to go just tilt from one ear and kind of touch your shoulder. So whichever way first you want to go. Okay. Any issues with that? Is that causing you any pain or discomfort? Excellent. The next thing I'm going to do is check her preauricle, postauricle, occipital, submental, submandible, tonsillar, superficial cervical, posterior cervical, and supraclavicular lymph nodes. So these are going to be your preauricles and the postauricles. Your occipital ones. Any pain, you're going to check for pain, swelling, anything that's hard and not movable. And she has no abnormalities noted along the lymph nodes. Any pain or discomfort with that?
No.
Okay. The next thing I'm going to do is check her thyroid. I'm going to check that from the back. I'm gonna check to see if it's swollen, or again, if it has any masses on it, or if it's deviated from one side to the other. Everything feels intact there. Any pain or tenderness when I'm palpating there?
No.
All right, very good. The next thing I'm going to do is check her shoulders and her upper extremities. The first thing I'll do is on both sides, I'm going to check her axillary, central, lateral, pectoral, and subscapular lymph nodes. So these were going to be kind of in this region. Sorry if I tickle you, I'm just going to reach under here. All right, again, nothing feels swollen or tender or painful there?
No.
Okay. And then we always check both sides to make sure there's not any abnormalities. One side compared to the other. Again, sorry if I tickle you. All right, very good. So for your shoulders, we're going to check the flexion and extension. Are you able to put your arms out to the side? Very good, you put it down. What about on the other side? Excellent. And then we're going to check for the tenderness along your sternoclavicle, acromioclavicle, subacromial areas for any tenderness. Make sure she's not having any discomfort in the shoulder region there. No tenderness in here, and there's no masses noted, no issues there. So then if you want to take and put your arm across the middle and then kind of rotate it out. Alrighty, bring it back in. It's okay. And then same thing on the other side. Very good. Put it out and then back in. Is that causing you any discomfort?
No.
Alright, go ahead and keep that arm and put it up above your head and bring it back down. How is that causing you any pain or any issues? Alrighty. And then do the same thing on the other side. Go ahead and lift it up. Is that causing you any pain?
No.
Okay. The next thing I'm going to have her do is check her cranial nerves again by having her just shrug her shoulders. Very good. So that is intact. They are the same, equal on both sides. And this time I'll also just go ahead and check her sensation on her upper extremities. So just tell me if it's sharp or dull.
Sure.
Okay.
Sure.
Dull.
Sure.
Sure. Dull. Sure. Dull. It's okay. We're also going to check her pulses and her radius. I'm going to check that on both sides. That's a nice strong 3+ pulse. And that's the radius on both sides. And check her brachial pulse. Very good. And that's also a nice strong 3. Yes. Very good. All right, and that's a 3+ as well, so they are equal on both sides. While we're looking at her arms, we're also going to check her elbows and the epitrochlear lymph nodes to make sure there's no tenderness or swelling here. So that would also be around this area of her arm. There is no swelling or anything hard. Is it tender when I put it there? Alrighty. And so we kind of did this earlier, but we'll double check again that your range of motion is intact. No pain or issues when you're doing that?
No.
Okay. We'll check that also on this side. Alright. No pain or inflammation there. Alrighty. And she also has no swelling, nothing inflamed, no hard nodes here. Very good. The last thing that we'll do with the arms is to test the strength. So if you'll just hold both your arms up for me, and I'm going to try to just pull them down. Oh, excellent. Very good. She has 5 of 5 strength in both of her arms. The next thing we'll do is take a look at her chest. Take a look at her chest. The first thing I'm going to look at is the shape of her chest wall and the AP diameter. Normal is a 2:1, and she is a 2:1 as far as here from the AP ratio here. The next thing I want to look is just make sure that she has the same shape, that nothing, she has no obvious lesions or injuries or anything to the front. The next thing we'll do is listen to her carotid arteries. I'm going to be checking for pulsations and also any bruits. So I'll have you turn your head first to the left, and then so we'll look for the pulsation in her neck here. And you can see that on the right side of the neck. Alrighty, I'm just going to hold this over here gently and listen. Very good. There's no bruits heard on the right side carotid. There's also no bruit heard on the left sided carotid. And I'll take a look for any pulsations here. To the valves, so there'll be the aortic, pulmonary, tricuspid, and mitral valves. So I'm going to first listen for the aortic. I'm listening for any murmurs that might be present. Okay. I'm listening to the pulmonic. Just breathe normal. All right. So I'm going to listen for the mitral, tricuspid, and then the mitral, While I'm doing this, I'm going to listen to her heart rate and rhythm. It is a normal rhythm with the S1 and S2, and there's no murmurs noted. No S3, no S4. Breath out. You take a deep breath in through your mouth, okay? All right, so deep breath in and out. Very good. Deep breath in and out. So these areas would have bronchovesicular sounds. And then you'll take a deep breath in and out, in and out, in and out. And last time, in and out. All right, and those areas would have vesicular breath sounds. Now we will take a listen, looking at her posterior chest. We're going to check for any tactile fremitus. What I'm going to have her do is say, we're going to percuss to see if there's any abnormalities. All right, very good. All right. The next thing I'm going to do is assessing for echophony and bronchophony. The first thing that I'll have her do is the echophony. And if you could please say E.
E.
All right. If you could say E.
E.
Say E.
E.
And if you could say E.
E.
All right. If I would be able to hear that clearly, it would be probably a signs of some type of pneumonia or consolidation present. The next thing is I'll do the same thing and have her say 99.
99.
All right. 99.
99.
99.
99.
And 99.
99.
Very good. Same thing. If you would be able to hear the 99, it would mean that there's a chance that there's a consolidation present. All right. So the next thing that we're going to do is take a look at her abdomen. So I'll have you come to the front. And you just want to lay down slowly. Okay. good. All right. Are you okay if I pull your shirt up just a little bit?
Yes.
All right. So with the abdomen, the first thing that you do is check and is inspection. So we're looking for any masses or any pulsations from her aorta. Then the next thing that we are going to do is to percuss, to auscultate. We're going to do that before we push or do anything on there. All right, good. Very good. So all of her abdominal sounds are present in all 4 quadrants. When we were looking at her belly, we're also going to check for any like surgical scars or ostomies or anything else that might be present. So the other thing we might do at this time is just to percuss to see if there's any dullness or tympany. That would help us to be able to listen for where her liver might be or her spleen. So that goes from being dull to where the tympany is. So the spleen's to there. All right, and so then we're checking for the liver, and where it stops being dull, again, and the tympany starts, it would be the beginning of her belly, and the liver would be up above that. The next thing that we'll do is the light palpation. Well, the whole time we'll check her face to make sure that she's not showing any signs of it hurting her. At the same time, we could check over her bladder to make sure she's not having any pain over her bladder. And then the next time you come through, you push a little harder, checking the size of the internal organs. You can also check her artery, abdominal artery at this time for size or any pulsations. Is any of that bothering you?
No.
Or you no tenderness over your bladder?
No.
All right, very good. This is also a time where you can check and see if she has any concerns for appendicitis with the SOSA and the ARB turbiter signs. The SOSA, she would lift her right leg up, and I'm going to push down. All right, does that cause you any pain in this area? Okay, you can relax. For the arbiters, I'm going to have you turn onto your left side. Be very careful. All right, excellent. Now I'll have you bring your right knee up. All right, and then I'm going to hold, not trying to hold, and then just going to bring your leg up. Does this cause you any pain?
No.
All right, very good. So that is a negative arbiter sign. If either of those had been positive, it would mean she had a potential appendicitis. All right, excellent. All righty. At this time, we can also make sure while she's laying flat to look at the anterior chest, again looking for lifts or heaves, and we can feel that, palpate to make sure that she doesn't have any, any lifts or heaves from her heart, and none of that is present there. So I'm going to help her sit up. Alrighty. Next thing that we're going to do is look at her lower extremities. We're going to check her hips for any edema or deformities. She doesn't not noted to have any of that. No pain or anything in her knees, her legs. Is there any tenderness when I push on there for you?
No.
Alright. So let's see. Probably, can I have you come to the edge of the table a little more? Alright, excellent. So we're going to check the ankles here for any swelling or anything as well. Okay, can you pull your toes towards your head? Check for strength here, that's intact, being pushed down. Excellent, she's got nice strength to her ankles there. Can you push your legs out? Excellent. And pull it back towards the chair. There you go. So nice 5 out of 5 strength in her knees and her ankles. The next thing that we're going to check is the range of motion of her hip and her knees. Probably the best thing to be able to do is to have her step down for that. Alrighty, so for your hips, I'll have you, if you can put your leg out to the side. Very good. Can you try that on your left side? Very good. Alright, and can you bend your knee up? Very good. And on your left leg. Alright, so she has nice range of motion there. Can you turn your leg out to the right? And then on your other leg. Alright, so she has the abduction and adduction. She has internal and external. Actually, point them both in. And
One at a time?
Yep. The right side, very good, and the left. So she has internal and external rotation in both of her legs, as well as abduction, adduction, flexion, and extension in both the knees and the hips. And then her ankles are also good. The next thing that we're going to do is check for her sense of balance and coordination with what's called the Romberg test while she's standing here. So we'll just have you close your eyes, and then I'm just going to push you over some, and she stands back up. Then I push her over to the other side, and she stands back up. Very good. Next thing I'm going to have you do is hold your hands out like you're holding a pizza, and close your eyes. And very good. There's no drift, so she has no palmar drift noted there. The next thing that we're going to do as far as check her coordination. Let me pull this back out. Have you sit back down. Alright, so we're going to check the coordination of your upper extremities. If you want, you'll take your right arm and touch your finger to my finger. Alrighty, and then just put it down, and then here, and then put it down, and then your right arm, and put it back down, and then your left arm. You can put it back down. Perfect. The next thing that I'm going to have you do is check the same thing. We'll do the coordination with your legs. So let me have you lay back down. Very good. So you're going to do the same thing with your legs, okay? Can you take your right foot and touch my finger? All right, put it down. Can you bring it over here and put it down? Very good. Now with your left leg, can you touch my finger? Very good. Put it down. And again, and put it down. All right, now while you're laying down, I didn't get a chance to check your pulses earlier, so I'm going to check your femoral pulse in the right. Very good. Check your popliteal pulse. You actually have to take your shoes off. Sorry about that. I like your socks.
Thank you.
Alright, check your dorsalis pedis pulse and your posterior tibialis pulse. Those are nice, strong 3+ pulses on the right. And we'll compare those to the left. We'll just start with the posterior tibialis, dorsalis pedis, popliteal, and again the femoral. Alright, so she has nice 3+ pulses all the way down. Let me help you sit back again. Alright, so now we're going to assess her deep tendon reflexes. We'll start first with the biceps reflex. So you're going to relax your arm and line. Just relax. Alright, so very good. Alright, the next one I'm going to check is her triceps reflex. So again, just be relaxed. Very good. And then the last one here would be the brachioradius reflex. Again, relax your hand in line. Alright. Very good. Alright, do the same thing on her left. start first with the brachial reflex. Very good. We'll just do brachial radius. Very good. And then just relax here. Very good. And last but not least, we're going to check her patellar reflexes here. Very good. All right, and then I'm going to check her Achilles reflex. Just relax. Very good. Very good. All right. And the very last thing that we'll have her do is check her ability to walk from heel to toe. All right. We'll just walk one foot in front of the other and make sure that she doesn't have any changes with her gait and that she can walk straight without falling over or have any balance issues. All right. Perfect. You did very good. All right. Well, thank you very much, Emma.